So a lot of times you do oral care for your VAP protocol, intubated or not, you're going to do oral care, and you're trying to do it and you have a patient bite down, and you can't do anything. This happens quite a bit. So if this happens, you can use the no bite. Basically, you have a light, so you enter the mouth, the patient bites on this, they bite on the no bite, it's safe to bite on. It's the same material as a Yankar, and since they're biting on this, you can now go in and do your oral care the way you normally would need to do. The beauty of this is even on that biting patient that's not giving you much room, you could actually look inside the mouth and do your oral assessment now that you couldn't do before because they were giving you, they were biting down so much. The other function is also for nasotracheal suctioning. You actually never have to do nasotracheal suctioning ever again. A lot of times it causes coiling, a lot of times it causes nasal bleeding, especially with patients who are on blood thinners. So instead, you can actually do oral pharyngeal and oral tracheal suction. Basically, you just take out the pillow. For more of your awake patients, you would do oral pharyngeal suctioning. So you tilt back the head, you would go in, depress the tongue, and you actually just want to go in maybe about 3 inches, and you're gonna hit the laryngopharyngeal area, which is where most of the secretions hang out. This is more of your awake patient, so you're going to stimulate them to cough and bring up more phlegm. If it was somebody who was more lethargic and heading towards a intubation, then as a last-ditch effort, you could do some deep tracheal suctioning. So in that case, you would tilt the head back, basically go in, depress your tongue, and when you insert your suction catheter, you could go deeper, and you'll suction out the trachea. You will gag your patient in this case, but this is more of your lethargic patient. They don't have much of a gag left at this point, and you're only going to be in the mouth for 5 seconds, so it really minimizes the gag. The real evil is if you don't suction that patient, because that's basically going to end up with a certain intubation. So we hope to prevent those intubations.